Hello students, I'm Dr. Gaurav and today we focus on the leg. Before understanding the different compartments of the leg, we need to study the transverse section of the middle of leg, transverse section through the middle of leg. So this is tibia, the medial bone of leg. This is fibula, the lateral bone of leg. So to the medial border of the lateral bone and to the lateral border of the medial bone is attached the interosseous membrane, and it separates the anterior compartment of leg from the posterior compartment of leg. Fibula also has got an anterior border and a posterior border in addition to the medial border. So to the anterior border is attached the anterior intermuscular septum, and to the posterior border is attached the posterior intermuscular septum, and between these two septa lies the lateral compartment of the leg. Posterior compartment of leg lies posterior to the interosseous membrane, and this compartment is divided into superficial, intermediate and deep parts by the superficial and deep transverse facial septa as shown in the figure. So we must appreciate that the leg has got three compartments: anterior compartment, lateral compartment and posterior compartment. Anterior compartment and posterior compartment are separated by the interosseous membrane, and the lateral compartment lies between the anterior and posterior intermuscular septa. The nerve supply of the anterior compartment is deep peroneal nerve, of the lateral compartment is superficial peroneal nerve, while the nerve supply of the posterior compartment is the tibial nerve. The arterial supply of anterior compartment is anterior tibial artery, of posterior compartment is posterior tibial artery, while of the lateral compartment it is peroneal artery, a branch of the posterior tibial artery. So once we have understood the compartmentalization of the leg, we can study the muscles in each compartment. So these are the muscles of the anterior compartment, and they pass deep to a thickened deep fascia retinacula, the superior and inferior extensor retinacula as shown in this figure. So they are thickenings of deep fascia. The inferior extensor retinacula is Y-shaped and the structures are passing deep to these retinacula. They are identified in relation to the retinacula from medial to lateral side. There is a mnemonic to remember these structures. Tina has a nice dressing table. Just keep this mnemonic in your mind and just identify and name these structures to the examiner, keeping the mnemonic in your mind. Don't mention the mnemonic to the examiner. So let us see what the structures are. T stands for tibialis anterior. Anterior compartment is also called extensor compartment because it has got extensor tendons, extensor hallucis longus and extensor digitorum longus. So T stands for tibialis anterior, H stands for hallucis, extensor hallucis longus. A stands for artery of anterior compartment, that is the anterior tibial artery. N stands for nerve of anterior compartment, which is the deep peroneal nerve. Then D stands for digitorum, extensor digitorum longus tendon, and then T stands for tertius, peroneus tertius. So these are the structures passing deep to the extensor retinacula from medial to lateral side. Now let us see these muscles one by one. Tibialis anterior is arising from the lateral aspect of the medial bone, lateral surface of tibia, and this tibialis anterior is going towards the medial side of the foot. It is an inverter of the foot, and this tibialis anterior is getting inserted onto the inferior-medial surface of the medial cuneiform and adjoining part of base of first metatarsal. Then we have the extensor hallucis longus. Extensor hallucis longus, extensor digitorum longus and peroneus tertius, they are all arising from the medial surface of fibula, and extensor hallucis longus is getting inserted onto the distal aspect of the dorsal surface of the distal phalanx of the big toe. So it's getting inserted onto the dorsal surface of the distal phalanx of big toe. This extensor digitorum, it splits into the four tendons for the lateral four digits, and it gets inserted onto the middle and distal phalanx of the dorsal surface of the middle and distal phalanx of the toes. And these two muscles, they are responsible for the extension of the metacarpophalangeal joint and interphalangeal joints of the digits concerned. Peroneus tertius is arising from the lower part of the fibula, the medial surface of the fibula, and it is going towards the lateral side of the foot. So it is an everter of the foot, and this muscle is getting inserted onto the dorsum of the base of the fifth metatarsal bone. All these muscles, remember students, they are passing in front of the ankle joint, so they are dorsiflexors of the foot, and all these muscles are supplied by the deep peroneal nerve. So once again, structures passing from medial to lateral side below the extensor retinaculum or deep to the extensor retinaculum are tibialis anterior, extensor hallucis longus, anterior tibial artery, deep peroneal nerve, extensor digitorum longus, and the peroneus tertius muscle. Now we come to the muscles of the lateral compartment of the leg, and they are the peroneus longus and peroneus brevis. Peroneus longus is the superficial muscle, and these two muscles, they pass deep to the thickening of the deep fascia called the peroneal retinacula on the lateral aspect of the ankle, as shown in this figure, superior peroneal retinacula and inferior peroneal retinacula. Now peroneus longus muscle, this muscle is the superficial muscle. It passes towards the cuboid bone. It passes through a tunnel underneath the cuboid bone, and it gets inserted onto the lateral aspect of the medial cuneiform. Now to this medial cuneiform was also attached the tibialis anterior on the medial aspect. So on the lateral aspect of medial cuneiform and adjoining part of base of first metatarsal is attached the peroneus longus muscle. So together with tibialis anterior, the peroneus longus is attached to the medial cuneiform on either side, and it keeps the middle of the foot pulled upwards like a sling. Tibialis anterior and peroneus longus, they form a sling. So peroneus longus is on the lateral side, and peroneus brevis also passes deep to the retinacula. These two muscles, both of them arise from the lateral surface of the shaft of fibula, and they pass deep to the peroneal retinacula, and the peroneus brevis gets inserted onto the lateral aspect of the base of fifth metatarsal. And these two peroneal muscles, they are going towards the lateral side, so they cause eversion of the foot. And also peroneus tertius of anterior compartment causes eversion of the foot, that was inserted on the dorsal aspect of the base of fifth metatarsal, while peroneus brevis is getting inserted onto the lateral aspect of the base of fifth metatarsal bone. So the nerve supply of the muscles of the lateral compartment, that is the peroneus longus and brevis, is the superficial peroneal nerve. Now we come to the muscles of the posterior compartment of the leg. So the muscles are classified as superficial and deep muscles. So we have got Gastrocnemius, Soleus, and Plantaris. They are superficial muscles. Deep muscles are popliteus, but this does not reach the ankle. This lies towards the knee joint only. Then we have Flexor digitorum longus and hallucis longus, which lie in the intermediate part of the posterior compartment, and Tibialis posterior, which lies in the deep part of the posterior compartment. So Gastrocnemius, Soleus, and Plantaris, they lie in the superficial part of the posterior compartment. So the tendons of all these muscles except the popliteus, they pass deep to the flexor retinacula. Now flexor retinacula, it extends from medial malleolus to the medial tubercle of calcaneum, and the structures pass of the back of the leg, they pass deep to the flexor retinaculum. Now the mnemonic here is Tina deserves a nice husband. T stands for tibialis posterior, D stands for flexor digitorum longus, A stands for artery of posterior compartment, that is the posterior tibial artery, N stands for nerve of posterior compartment, which is the tibial nerve, and then H stands for flexor hallucis longus. So these structures, they pass deep to the flexor retinaculum. Remember, you don't have to mention the mnemonic to the examiner, that is just for you. You need to know the structures as they pass deep to the flexor retinaculum from medial to lateral side. Now when we study the muscles of the superficial compartment, the gastrocnemius, it unites with the soleus, and then these two muscles, they combine, and the common tendon is called tendocalcaneus, and this tendocalcaneus is inserted into the middle 1/3 of the posterior surface of the calcaneum, and together the two heads of gastrocnemius and soleus are referred to as triceps surae. and Plantaris is getting inserted on the medial aspect. And when the four muscles are considered together, Gastrocnemius, Soleus and Plantaris, we use the term quadriceps surae. Now these muscles are getting inserted via the tendocalcaneus as shown in the figure. Soleus is also called peripheral heart because Soleus has got uh, veins without walls, and this is a strong muscle, so when it contracts it pumps the venous blood against gravity, and when this muscle relaxes it sucks in the blood from the superficial veins. So Soleus is also called the peripheral heart. Now this is showing the muscles of the intermediate part of the posterior compartment, that is the flexor digitorum and flexor hallucis longus, and also the muscle of the deepest part of the posterior compartment, tibialis posterior. Now just look at the arrangement of muscles here. The flexor hallucis longus is going to the thumb, but it is arising from the lateral bone, posterior surface of fibula. Flexor digitorum longus is going to the digits, but it is arising from the medial bone, the posterior surface of tibia. The tendons, they cross in relation to the proximal part of the plantar aspect of the foot, and this explains why the muscle arising from the fibula is going towards the thumb, while muscle arising from tibia is going towards the lateral four digits. Tibialis posterior arises from the interosseous membrane between the tibia and fibula and adjoining posterior surfaces of tibia and fibula, and this muscle is getting inserted into all the tarsals except the talus. The main insertion is on the tuberosity of navicular bone, and the insertion also extends to second, third and fourth metatarsals. So tibialis posterior has got a huge insertion. So this was about the insertion of the muscles of the back of the leg. Now you also need to understand the medial part of the tibia and the concept of guy ropes. Now guy ropes is an arrangement to stabilize the pelvis on the femur. So here we have got three muscles. One muscle of the anterior compartment of thigh, sartorius, which arises from one component of hip bone, that is the ilium, the anterior superior iliac spine. A muscle of the medial compartment of the thigh called gracilis, which arises from another component of hip bone, the body and inferior ramus of pubis, and semitendinosus, which arises from another component of the hip bone, the ischial tuberosity, and semitendinosus is a muscle of the posterior compartment of thigh. So anterior compartment, medial compartment and posterior compartment all are represented by a muscle, and these muscles, they get inserted into the upper part of medial surface of tibia, and their attachment is like the ropes of a tent, and these ropes here, they stabilize the pelvis on the femur, and this arrangement is called guy ropes. So I hope students you have understood the arrangement of the different muscles, the origin and insertion of the muscles. The muscles of the front of leg, they will cause dorsiflexion of the foot. Muscles going towards the medial side of the foot, they will cause inversion of the foot. Muscles going towards the lateral side, they will cause eversion of the foot. So the whole concept, regarding the anatomy of the leg comes from an understanding of the transverse section of the leg. So from this portion, you need to know the diagram of the transverse section of the leg. Then you need to know the nerve supply and the arterial supply of each compartment, the different retinacula and the structures passing in relation to the retinacula, the arrangement and the insertion of the main muscles, and along with that the concept of the guy ropes. So I hope you understood today's class, and follow the notes with the class, and you can contact me if you have any query regarding the class. So thank you for your time.